looking for when the quads overtake the pelvis. So what so if you all look at his anterior pelvic rotation, just relax as good as you can. It happens almost immediately. Do you work out a lot?
Yeah.
You do a lot of squats, lunges?
Yeah.
Okay. So he has really big quad tone. Now for him it's not a problem, but for somebody who is maybe excessively anteriorly tilted because of the quads and the abdominals and back extensors can't overtake that, we might have to watch out for that. For him it's no big problem. But so that would be just like with the inclinometer measurement. I would want to note when I did, you do a good job. So he is somewhere in the 25-degree range, when we want to be somewhere in the 80 to 100. But for him, it's not a problem. You always have to ask, when you get a positive finding like that, is it significant? He has no pain, it's not causing him any trouble, it obviously hasn't changed his dynamics enough to where it causes issues, no issue. All right? So with your patient, you have to say, when you get that, is it part of what's going on? So we'll go ahead and push it towards the maximum. And you can see how much he gets lumbar lordosis as he goes. Okay. Any problem there as you go? Any problem along the front of the hip? Just looking at the femoral nerve, you don't get a lot of problems with that. There's a couple ways you can tease it in or out. If you do get tension, he could extend his head, so lift your cervical spine. That decreases the tension on the entire system. See if that decreases his tension. You could take quite a bit of knee flexion away and extend the hip, which would put a little bit of tension on the quads, but not a lot, and see if that comes back. So you take somewhere off, just like we did with the other two tests. You take some tension off one place and you add it in another that wouldn't be comparable. Does that make sense? You could also do it up on a pillow to even get a little bit more hip extension with that. Okay? Passive prone knee bend. All right, so now let's go to so those are the assessments. Let's go ahead and turn on your back. And I want